Hi, this is Dr.Kang's Scuba Diving Stories. Probably one of the most frequently asked questions on diving and I is glaucoma. Quite a number of people suffer from this disease and they ask if they can dive with glaucoma or after some surgery. So glaucoma is like it's an increased pressure inside the eye, and it can damage the optic nerve, which transmit the vision signal to your brain, and then you can lose your vision. This is quite common, and this is quite serious disease. But glaucoma is not affected by diving, by increased ambient pressure. So many people worry because it's the elevated ocular pressure. So if we go underwater, the ambient pressure also increases and it could damage the disease and or the eyeball. But it's not true. It's okay to dive as long as you can see, But there is some issue with glaucoma with medication and surgery. So what about the medication? There are two medications used. It's a timolol, which is eye solution, can cause bradycardia, which is a slowing of heartbeat, and you can lose consciousness on the water, which is very serious. Excuse me. Oral medication, Diamox, can give you some tingling sensation on your hand and your feet, so you can confuse with symptom of some neurological symptom of decompression sickness. So as long as you're aware of this, probably you can ask your doctor for substitute, or if that's the only one you can get, probably you just be very careful, or at least to stop using the solution or even the medication for some certain period of time before diving. There's some surgical problem too. Glaucoma surgery, there are two main surgeries. One is laser treatment, one is glaucoma filtering procedure. It's an incision in the eye to evacuate the pressure out of your eyeball. Let's look at this one. We cut this part of eye with laser, so the pressure can be evacuated. This doesn't really bother after surgery to dive, But but this one is giving an incision in your eye so that the pressure can come out. But this can cause some serious complication when you dive, and mask squeeze, mask barrel trauma can have adverse effect on the functioning of the filter. So it can worsen the disease. And when you as a diver, when you have to do the surgery, you have to ask your doctor what kind of treatment or surgical modality he is going to use. So tell him that you are a diver and you don't really want the filtering procedure, which is the incision in the eye. So rather do a laser treatment. So this was about the glaucoma. To sum it up, glaucoma itself is not affected by diving. It's okay to dive, but some medication that can give you bradycardia, which can give you tingling sensation, you have to be very careful about it. and also some surgical procedures called filtering procedure. This can bother your diving, so make sure you check with a doctor first. Thank you very much.